Hello, and welcome to Young Lung Cancer Initiative's patient education series on surgery with young lung cancer. We've already done 2 episodes on this topic. The first was what happens before surgery? How do you get to surgery? The second was what is happening when you're in the hospital? And this last one's going to be on now what? We're out of the hospital, we're not being watched, and how do things go? What do we do? How do we manage? So, we're going to talk just a little bit today. I'll ask some questions and I'll probably just call on people to answer them so we can try to answer all the questions that we get frequently asked because there's a lot of them. So, thank you again to my friends that have joined us for this panel. I think this will be beneficial to people all over, no matter how old or young they are, when thinking possible lobectomies or wedges. So we're diagnosed. We're all excited. For most of us in this situation, that meant the chest tube is gone. Haley did have her chest tube a little bit longer, but then it's time to go home. And for those of you that are local, that was probably relatively uneventful. But for myself and Mariah and Haley and Terry, we all had to travel home. So do you have any tips for driving or flying home?
What helped for me was bringing really comfortable, loose fitting clothing to the hospital. And what I didn't think about was tying my shoes. I couldn't tie my shoes right away. I mean, I guess if you have shoes that are comfortable, that don't need to be tied, that you can just slip on, that's a good way to go. Otherwise, it was pretty non-remarkable of my trip home. We flew back 2 days after my surgery. It was fine.
You were good.
Yeah.
Haley, what about you? Any tips for traveling or flying home?
Definitely have a buddy with you. If you're flying, make sure that however you pack is manageable for one person to take care of. I didn't require a wheelchair. I could walk through, but I definitely needed to make sure because I wasn't able to pull luggage or carry a backpack or anything like that, that what I packed was manageable for my husband to do.
That's great advice. Mariah, how about you?
I didn't plan on staying at the hotel, the Rotary House, longer than being in the hospital gown, so I didn't pack as many loose-fitting clothes like Terry recommended. I had to buy a bunch of MD Anderson t-shirts with the chest tube not touching anything. So I did have to be wheeled in the wheelchair at the airport, but I was able to walk to the restaurant, take smaller, shorter walks. But yeah, I couldn't have walked through the whole thing. And definitely the buddy for sure.
I think for me, my mom and my husband stayed with me the entire time that I was there. And when we flew home, it was a full flight, but my husband was able to upgrade my mom and I to first class so that weren't as many people around. One is I was kind of freaking out about getting COVID after I'd had surgery. So I was wearing my mask, but also being bumped or pushed. So if that's an option for you to be able to fly first class just to give yourself a little bit more space and you're one of the first people on, that is a kind of a nice bonus. And the other thing is at MD Anderson, they give you a bear called Sir Coughs a Lot, I think is his name, to hug when you're coughing. I actually did not use him. I had a pillow that I had brought with me, and I thought that was nice for the plane because I could just kind of put it extra padding around just because you are a little bit sore. Okay, here's a big one I always get asked. When did you find out about your pathology? Like, how did you know? Did it all come at once? Did it come in multiple parts? So, Lexi, I'm going to let you answer that.
So my initial pathology came back a week later, and it showed what of the lymph node, every single lymph nodes, what had cancer, what didn't, the area around the tumor. It showed the percent of the tumor that was scar tissue versus necrosis versus active tumor. So that came back a week later. But then I had asked my surgeon to send it out for genetic sequencing. And that was something that um, he just hadn't originally planned on doing. I'm not because he didn't think it was necessary, but because his focus was the pathology. And so after that came back, then a couple weeks later, I got the full genetic sequencing back.
Okay, so just a little bit of time there.
Yeah.
Yeah, and I think that most people I talk to that have had the surgery, you get some back within a couple of days while you're still in the hospital for those of us that are there a little bit longer, and then you get the rest, a week or so later. Does anybody have anything to add to that? Ashley, I know yours is a little different. I was going to say, what was your experience since you were hoping this was curative and it was just going to be gone?
Yeah, so I had 9 lymph nodes removed and the left lower lobe. That pathology came back in a week. And when I had gone to my second opinion, that's when they told me that basically the majority of young lung cancer in women is due to gene mutations, and so they would check for that. So I'd called back my primary thoracic surgery team and asked if they would do that. I talked to a nurse practitioner, not the surgeon, as you usually do, and they said, yeah, they would send for that as well. So when they called and told me it confirmed stage 1 and that they got clean margins, my next question was, did I have a gene mutation? And they said we didn't look. And I was really kind of frustrated, honestly. But standard of care for stage 1, since the surgery can be curative, is not to look for a gene mutation, which I think is a complete disservice because it gives you a lot more information, and there are clinical trials for lower stages. Mine was stage 1A. Anyways, they said it would be like a second opinion. At that point, I had never even met with an oncologist, so I asked to be referred to an oncologist. I had to wait to get in to see him, and then he agreed with me to order the gene testing. So I didn't find out about my ROS1 gene mutation until like 5 or 6 weeks post-op.
That is different because those of us, everybody else, we already knew we had at least one mutation from diagnosis. And then it was more of the piece of like, am I going to have a second? Or where else, was the cancer really not active or was it active and how much and all the other kind of things. So I appreciate you sharing that. That's interesting. The next thing I would like to ask, because this is another one that gets asked a lot, is what are your restrictions after surgery? What kind of restrictions do you have? Terry, what about you? With you having the robotic assisted, do you have restrictions after surgery?
I mean, I felt like I should have more than I actually had because I was really nervous with activity that I was going to rip my lung open. I was really worried that I was going to harm myself with my activity. I really couldn't lift anything or be too strenuous with anything for, I'd say, at least 2 months. But I was walking the same day, the next day. Dr. Serfolio just said, walk as much as you can, at least 45 minutes a day, and try to get back to your normal life as fast as you can because that's what's going to increase your lung capacity. So no lifting and no driving while I was on narcotics.
Okay, so just two restrictions. Let's see, Haley, what about you? Different type of surgery. What were the restrictions you had?
No, like I didn't even think about this ahead of time, but I couldn't vacuum for 4 to 6 weeks. So we had a Roomba. So we have a big dog. That, and then like as far as driving, my husband works at the hospital, so I kind of just took the narcotic pain medication more at night so that I could drive during the day. I was kind of just like driving with my right hand just to the end of the street to do carpool or bus stop or whatnot. But the vacuuming, picking up anything heavier than a gallon of milk was kind of like the big things for me.
Yeah. Mariah, since you had a little bit more complications and a longer recovery, what about your driving? Because that's something people always ask. When can I drive?
Oh man, I couldn't drive for at least a month, I think, because I was constant on that pain medication. My mom stayed with us, and I'm so thankful because she really took the reins, watching over the kids and driving for me, and my husband helped out a lot. But yeah, it was really like a month and a half that I couldn't do hardly anything. When I started physical therapy, I couldn't extend my arm like much past my waist. I was like, just so I was a zombie.
Yeah, I think I was told not to drive for 5 weeks till I came back from my post-op appointment, even if I wasn't taking narcotics. And I did follow that rule only because I'm a rule follower. But I also drive a very large car. And if I just kept thinking if I didn't feel like I could turn to get, it's hard to see out of those things anyways, to get good visibility. And I didn't feel like if I was in an accident, like that's a lot of weight in a car. So I did not drive. But I think the biggest key is definitely no driving while you're taking narcotics, because that's a whole nother can of worms. So the driving thing is kind of a pain. This kind of will lead us into the next one is, what do you need help with when you get home? Like, what are the things that you needed help with and who helped you? And how did you what were the biggest things that were helpful to you, or what wasn't helpful, or what kind of advice you would give for when you get home? And so I'm going to ask you, Lexi, to kind of talk about maybe what's the best help or things maybe to do differently?
So I was also very lucky. My mom came up and she helped a lot with the kids, took them where they needed to go. My sister organized a meal train. One of my other girlfriends organized a carpool sign up sheet for my kids, which was really helpful. I think it's kind of like giving yourself. I mean, I'm someone that likes to jump in and do things, and like if I see the floor's dirty, like I want to go and clean it. And what when I would lean down to clean something, I felt like my insides were like, like they like all kind of jumble up with themselves. And so I think just the best thing is to kind of give yourself time. I got a lot of loose pajamas and that was very comfortable. And kind of have to let other people take the reins a little bit. On the point of meal trains, I will say it was super helpful. I think people, and Leah and I talked about this, that people give so much food that I think, we had so much food, which was it's a nice problem to have, but you don't want to waste it. So if you have a meal train, sort of recommend like doing it every other day or just a few days a week. People want to help. And I think the best advice I could give is sort of tell people exactly how you need help, because then people may offer to do things or do things in ways that, and then it's kind of feels weird to say like, no, I don't want that. And so it's kind of like, and part of that is upfront is something that can be done as well, of saying like, what do we need? How do we prepare? And being very clear about it. And then just giving yourself time and grace.
Yeah, it's odd as an adult, and especially I know a lot of us are strong, personalities and women and used to doing things for ourselves. And then you find yourself in a situation where you can't do for yourself, which means you can't do for your other people. And it's kind of a snowball effect. Ashley, because you were early stage, sometimes I think people discount how serious that really is and how serious your surgery and recovery could be. So what did you find? What did people do to help you? What did you need help with? What was helpful for you?
Well, I needed a lot of help because I'm a single mom. So I had people staying with me. So I had like a stay with Ashley sign up. So I was very blessed to have friends and family all take turns to babysit me and be my helper. And then I would say just one thing that was like so must have for me is a recliner. I didn't have a recliner in my house. And I was lucky enough that my insurance, like a nurse called and recommended that. Because I had incisions from the chest. Well, I have 6 incisions for my surgery. I couldn't sleep on a side. I couldn't sleep on a back. It was brutal. So everything gets better with time. So not to scare people, but I needed help turning and positioning pillows. And sometimes that was in the middle of the night. So I really appreciated that recliner as another place to try to sleep.
I would agree. Sleeping was really hard. And I can remember I was like, finally found out that I could sleep on the couch better than I could like in the bed, even though we have the automatic bed. And then I was like, man, why didn't I get a recliner? I mean, we bought one when my husband had surgery, and then I got rid of it because I didn't like it the way it looks. I should have kept it and used it as a
Yeah.
recovery tool. Anything else that you all thought really helped? Mariah, I know we didn't ask you to weigh in, or Terry, what kind of things really helped you guys when you all were having your recovery time?
Honestly, it was just the extra hands for me, not having to deal with the kids, the toddlers, especially they didn't really understand that mommy couldn't hang around this side of my scar area. They would, if one started jumping on the couch, the other, and it's like, no, I'm gonna get up away from you guys. So it was nice to have the extra hands to help with them. I don't know how I would have done it without them.
Yeah. What about you, Terry? Because you had older kids.
Yeah, because my kids were a little older, they could help quite a bit, and they're pretty self-sufficient. And 2 of them were drivers, so they're built-in carpool. What I didn't think about until after I had the surgery was my dog, my black lab, who's glued to my side and sleeps with us every night, kind of snuggled up to me. That was not possible. After surgery, it was really painful. So she was confused about why having your dog on the bed with you is painful after lungs.
Surgery.
So the
Yeah.
other thing that I didn't expect was needing help to get up and down from the toilet.
Ugh.
So that's something, and I am just remembering this now. Sitting down on the toilet, use those muscles that were on fire and the nerves that were on fire. So I needed a little bit of help with that initially. Otherwise, I thought, we did receive some meals, just ad hoc meals. We didn't do a meal train. We just had some friends bringing us over some random meals, but also gift cards to local restaurants. That was really helpful because then we could just order what we needed when we needed it, or DoorDash. It was really, really convenient as a mom who, usually it's me getting the dinner on the table and just to have that option to have something delivered.
Yeah.
It was really, really helpful.
My kids are older too, and I have one away at college, and then I have a senior in high school, and then an eighth grader. Problem is, my senior is my daughter, the one that's most likely to help and most capable of help. She does an internship at a local hospital, so she wasn't available as much. So my mom, God love her, was with me almost every day until I could drive, doing something. And for me, the biggest shock was laundry. I mean, I know we have a lot of laundry. We're all adult sized people, but I couldn't, carry it. I couldn't fold it very well because I'd be sore and I'd be like trying. So that was a big help. My mom did all of our laundry, which was huge, and we'll definitely be forever grateful for that. But laundry and then showering, that was the other thing. I couldn't, the first shower I took, my mom literally had to stand. I kind of backed up and she'd wash my hair, and then I'd lean forward because I just couldn't lift that right arm up to get soap out of my hair or whatever. So I definitely need help with showering. And I wasn't so much, the toilet wasn't as bad for me getting up and down. I don't know why, but it was definitely the showering that made things a little tricky. And I know you all mentioned things about carpooling. There is an app, it's for Android and for Apple phone, called Carpool Kids. It's the best thing ever. You fill out when the carpool is, the schedule, everybody just signs up for when they're taking, takes the paper out of it, but also if something comes up, it alerts people like Ashley can no longer pick your children up. So and then they're going to know who's going to fill in for you. And with older kids, not little bitties, but you can even say, check the app when you walk out of school, make sure you know who's picking you up. That's really helpful too. But that's just a little tip or trick when you have a lot of carpool too, because you need more than one carpool in the app. Let's see. Okay. So after we're talking about kind of the showering and sleeping, what do you do for caring for your scars or your incisions? What do you have to do for your incisions? Do you have to put bandages on them? Do you have to clean them a certain way? Did you have stitches? Kind of what was your incision like to deal with, Ashley?
So I used a combination of things when it was approved. So the chest tube obviously had stitches that had to be removed, and I had an issue with mine where it puckered. So I had to go back in early for that removal. That was the most painful. And then also I had one that my bra irritated a lot. So I used Aquaphor, good old Aquaphor. It's just the best thing ever. And so rubbing that on once it was approved by my doctor, and that initial tape kind of got off of it, right? Or bandage.
Berry strips.
Thank you. Once those got removed and I could start using things, I used Aquaphor on the one that was really irritated. And then I got scar cream and then eventually scar tape. And then because of Lindy, I learned about scar massage, which I started a month ago and has been a huge help because I definitely have issues with a couple of my incisions still.
The massage is huge. And I don't know about you guys, but I didn't really get MD Anderson. They told us that we could do massage and acupuncture prior to, but there was really nothing about afterwards. At least it was said to me. So because I had talked to Lindy too and had talked to so many other patients, I kind of knew to ask for physical therapy when I was in the hospital at MD Anderson. And they came to me and gave me a handout of stretches I should start doing it. How many days out, how many weeks out, what I should be doing. And then I asked Dr. Antonoff when I could start using my sauna, the infrared sauna, and when I could use massages again. And I can remember going to it's a therapeutic massage person that I use that focuses on more of chronic illness, people with chronic illnesses. And it was about 8 weeks after surgery, and I was still tender, but it was more of the scar, tissue, adhesions, binding. And so she was working it out. It's one of those hurt so good things, it hurt. But after it was done, I was thank you. Because it was I wasn't as tight anymore. I could move. So there's that as well. Lexi, did you do anything I think we all had steri strips, and then we were just told, at least I was, that just leave them alone until they fell off. and that was it. We had internal stitches, like our incisions had internal stitches, and then it was glued and then steri strips. So we didn't have to have stitches removed or anything like that.
Even on your chest tube, you didn't have to. Oh, that's
That was with
interesting.
that was an airlock. They pull it and they put this Vaseline patch right over top of it and it seals it.
So mine was definitely different, and I just had mine. So that's good for people to know.
Yeah, so there might be different chest tube policies. Lexi, how was yours? Like, what did you have to do for your incisions?
Mine was exactly what you just said with the steri strips, and same with the chest tube. That's exactly how mine was. And I am very like sensitive and allergic to everything. So the tape was really irritating. And I'd asked Dr. Lung if I could, rip it off after a certain number of days. And he was like, no. And I was like, well, can I, and I was like, well, what about when I have my 2 week, like, can you take it off then? And he was like, you mean like switch it out? And I was like, no, like, can it come off? And I think that he didn't want me to take it off before the 2 weeks, which I get. And then when I went in, they ripped him off and it was just like, God, because I, was allergic to the tape. But after that, not to wash with soap and water for another couple of weeks directly on it. Like it can drip over it, which is fine, but not to scrub. No, they said another 2 weeks after that 2 week post-op. So 4 weeks after, no direct like massage with soap or moisturizers or anything. So just kind of let things run over it. That was my guidance.
Terry, did you have a different experience with your chest tube? We're finding out there's more than one way to do things.
It was similar to yours, pretty straightforward. I had to remove the bandages the next day and then just leave them off open to air and shower with gentle cleanser. I had a problem with finding things that were comfortable to wear over my incisions and with my nerve pain. And Mariah, maybe you experienced the same thing because I had my pleural lining removed. There was so much nerve damage. Really, the only thing that worked for my incisions and my nerve damage was finding a bra, and I had to wear a bra because I couldn't stand things randomly touching my skin. I had to have something guarding my skin, but soft. So I had to find bras that did not have any underwire or seams.
Mhm.
And that took me a bit, but Soma had a lot of those, so that's where I went. That was the only thing that worked for me for about 2, 3 months.
I know I'm still wearing like super old nursing bras. I'll think I found something comfortable, but I still have like this numbness under my left breast. And the nursing bra for me is just what's super stretched elastic is what's the most comfortable still.
Right.
Yeah, that nerve pain is no joke. Mine, I weaned off the gabapentin and then it started coming. Then that's when I started having nerve pain. I was like, what is going on? And it was like electric shocks. And like I'd walk around holding like, it was like right here on my breastbone. And I'd be like walking around and I was like, are you having chest pains? I'm like, but yes, then that's a whole nother thing. But the nerve pain is, I feel like, worse than the almost incision pain because within a few days that kind of seemed to like get some better, but that nerve pain just hung on.
That was the worst for me.
Mm-hmm.
Haley brought up a good point. Haley and I actually are neighbors. We're about not even 10 minutes apart from one another. So we meet frequently, not as much as we'd like. And we talk about all the things that Haley and I have talked about our post-op. Like when you leave MD Anderson, I had like a whole, like there's a picture, people, if you follow me, you'll see it's like all these medicines from MD Anderson's pharmacy, which is really nice that they fill it all right there. So you're just taking it home with you. But Haley, could you explain a little bit about pain management and the different medications that we take when you get home and how that kind of works?
Yeah, so they kind of wanted you to stay on the same schedule that you were on in the hospital, minus obviously the IV stuff. So we were on Tylenol, gabapentin, Celebrex, Oxy as needed. Dilaudid was only whenever we were in the hospital. And then I also used lidocaine patches above and below my incision on my back, and I felt like that really helped. The thing that helped me most, because they were wanting you to wake up in the middle of the night, if that's when you were scheduled to get these medications, because that way it would stay active and help with aid in your recovery, because then you could easily move more if you stayed on schedule and you didn't have all this breakthrough pain. So they were great about that. So I literally just set alarms on my phone for all of the different times. Like we wrote everything out. My husband's in healthcare as well. So he's like, we're going to keep this schedule. This will kind of let you get the most sleep, but not have a lapse in medications. And we set an alarm. And on the alarm, I was like, okay, this is the time that I take this. This is the time that I take this. And just that kind of helped us stay on track a lot with that.
I agree. It was like we made a chart. My mom's a nurse, hired nurse. We had a big old chart, check it off. And it is kind of annoying to get up, wake up to take those medicines. But I will say, I don't feel like, other than the nerve pain, which is, that's the thing too, even on the gabapentin, I still would have a little bit of nerve pain. But the other pain I felt like was much more manageable as long as you stayed on the same schedule. Terry, how much, like, did you come home with pain medications? I know you talked about nerve pain, but, or was it mostly just controlled with Tylenol by the time you got home?
So I came home with oxycodone and gabapentin. I could not tolerate gabapentin, and that was really directed for the nerve pain. So that was the reason that I was feeling that so much. So I really just kind of went back and forth between Advil and Tylenol, and then did the oxy at night.
Cool.
And yes, I was waking up in the middle of the night to make sure that I took that pain medication, because if I didn't, it was pretty brutal. And once my incisions closed, the other thing that I found that was really helpful was hot baths with Epsom salts. I know it sounds so old-fashioned, but for me, taking one of those every day was so helpful for my pain.
I thought so too. Did the same thing. It did help. Something about that water. Lexi, what about you and your pain management once you were home?
Really, for me, once the chest tube was out, things were just a lot more manageable generally in terms of pain. But I just did for the first few days, I did oxy at night and Tylenol here and there. But then after the first week I stopped. I didn't have any of the other medications that were sent home, or that were sent home with all of you. And I'd say the only thing now that persists is I still have, like, my ribs still feel a little bruised, and then pain in my back. And then normally it's fine and tolerable. But when I have chemo, which now I just had my second round on Monday and I had my first round 3 weeks ago, everything, all the pains and aches flare up again. And so that's been sort of hard with, like, feeling, it's like, I thought we're past this, I thought we sort of moved on from that, but, like, no, it comes back. All my defenses are down, and, so I expect that that'll continue for a few months. And at least now I have, because I assumed afterwards that because I'm just on pemetrexed now, that it'd be easier because I dropped carboplatin, which is pretty rough. But no, the surgery has sort of complicated that a little bit in terms of just post side effects and treatment and all of that. So for me, it's really just about setting my own expectations. And now that I know, I can go into the next round and be like, okay, I'm going to be feeling these pains a bit more. Hope that it gets better over time.
Yeah, I could see that. Mariah, how about you? Did you have the same experience with all the pain medication that Haley and I had too?
Yeah, definitely had to stay on top of it. I remember I was just on the gabapentin for, I feel like it was longer than 3 months. Gabapentin, methocarbamol, and celecoxib. I needed to just keep, and then oxy when it was really, really bad. But those were the three that I relied on. I would try to wean off, and it was so hard. But it took forever to finally not need that pain medication. Yeah.
I guess along with this, I've heard several of you say you've got to give yourself grace, you've got to give yourself time. I'm the worst at that. Dr. Antonoff said 8 weeks. I thought, oh, great, I'll be back to normal in 4 weeks. If it's typical, I'll be 4. No. They're telling you it's that for a reason. You're not going to be better overnight. But I do get a lot of questions about, like, diet and exercise after surgery, breathing. So if you have any tips on, like, what's important to eat, or how soon you could exercise and what type of exercise you did, or what did you do to help your breathing and your lung capacity stay, that would be I think the listeners would like to hear that. Terry, do you have any advice on any of those things?
Really just getting up and getting moving was helpful for me. I felt like every other day I was exhausted. If I had a more active day on Monday, then I was pretty tired on Tuesday. So just understanding, I think maybe Lexi mentioned earlier, giving yourself a lot of grace when you're healing, but then also I would say push through some of the pain and get moving. You have to move a little bit. I had a small complication after my surgery. I had a really small air leak, and It felt like when I was trying to move, I was riding a bike with a flat tire. That's kind of what it felt like for me. Just couldn't quite do what I wanted to do, but just the walking every day consistently in the rain, in the snow, eventually kind of added up to me being able to do more of what I wanted to do. It is painful and it's uncomfortable, but I think you do have to do both. You have to let your body rest and you also have to get moving.
Yeah. Fatigue is an issue. Like, I mean, I think just post-surgical fatigue, having anesthesia and not being as active causes the fatigue. Plus, then we've got our O2 levels that are a little bit whack when you first have something done to your lungs. So
And you're
fatigue
under
is real.
treatment. Tagrisso causes quite a bit of fatigue for me, and I would imagine chemo does the same. So kind of moving through that as well, and just knowing that sometimes when you get moving, you feel more energetic than if you are not moving.
Anybody else with exercise? Anything that you noticed? I think all of us were told to walk. I mean, I think that's kind of standard to make sure you're walking.
Definitely walk. Different,
But anything else with exercise?
yeah, different PT strength, like just getting, trying to move your body and, lift some weights. And for me, a big thing was protein, and that's important before surgery and after surgery, and just kind of keeping up with that from a diet perspective.
Helps with energy and healing for sure. Another thing I had to remind myself to do because I wasn't in the hospital, the spirometer was kind of like a normal thing in the hospital. It was sitting like right on that table that's right there by your bed, and you're in the hospital and that's medical equipment. You kind of think, oh yeah, I need to do this. Was trying to remember, because I did not like doing the spirometer, to use that and make sure that you're using it to its full capacity. So that's something I used to set my alarm for too, to remind me. Otherwise I'd be like, oh, I'll do that later. And then it'd get to the nighttime and be like, oh, I haven't done that one like I was supposed to. So that was something that I really had to focus on with the breathing. Okay, so after you've gotten home and you've kind of been managing your pain and you're starting to walk and eat right and all those kind of things, do you have a post-op appointment and follow-up appointment? And how far out is that? I know, Lexi, you've mentioned like a 2 weeks and 4 weeks. Of course, you're local. So what's everybody else's experience with these post-op appointments and kind of what do they do and that kind of thing? Mariah, would you like to answer?
I can't remember when it was supposed to be. I feel like it was supposed to be like a month later, and a month or a month and a half, and I was going to fly out to MD Anderson, and I just remember calling like, there's no way I'm getting on a plane right now. And I think we pushed it back 2 weeks or something, and then Dr. Antonoff was on leave, and so it just became a virtual appointment.
Yeah. What about you, Haley?
I flew back about a month later, and they did a certain type of CT of my chest afterwards to check everything. And I really appreciated Dr. Antonoff actually reviews your images as well as the radiologist, because you will have those post-surgical changes. And is this something that is kind of showing up because of the surgery, or is this some sort of metastasis or cancer situations? I ended up actually I saw Dr. Gay. She was out of the office. I can't remember what for, last minute. So we did a phone conversation, but she was able to review my images before.
That's great. Terry, what about you? Like, what is your experience with that post-op?
So I had a video conference a week out from my surgery with Dr. Cerfolio. And then I spoke with him a few times on the phone just regarding my small air leak. But then I had an in-office appointment with my regular oncologist 2 months later to review the scans and look at my incisions. So it seemed pretty hands-off.
Yeah, they were. Lexi, what about you? I know you mentioned 2 weeks and 4 weeks. Did you have more than that, or is this standard? Or
No, so it was 2 weeks with my surgeon and then 4 weeks with my oncologist. And that's when I had chemo. And then I'll meet back up with my surgeon 3 weeks or 3 months post-op rather. So 2 weeks and then 3 months with him. And then my regular oncologist I see more often. And I'm not that far out. So February 25th is when I had my surgery.
you're pretty new out. So, I'm at MD Anderson as well. I have switched all my oncology care to MD Anderson instead of here in Louisville. So I went 5 weeks post-op because we had holidays. I was like at the end of October. And she did a chest x-ray just to make sure everything looked good. Dr. Antonoff did. And I saw both of them, Dr. Singhi and Dr. Antonoff, at that appointment. And then she followed up 3 months later with scans, and I'm seeing her again this time. When I see Dr. Singhi, I'll see him again, and as well as her for those kind of post-ops. I will say that at the 5-week post-op, she did tell me I could drive. She told me that I could start back to exercising regularly. It was the holidays, so I kind of waited a little bit longer. And I started with strength training over cardio because I was nervous about the breathing, which I think was a good transition into exercising because my muscles had had lessened. I'd lost muscle mass in the 5 weeks that wasn't working out. And so that's kind of how I eased myself back into it. I felt like I just kind of kept adding a little bit more. And now I'm pretty much back to where I was before surgery. But, the post-op appointments are interesting. I think they went over all of my, like all the tissue sampling that they did, the biopsy results, all the things. One thing I will say, and I know several of us have mentioned this talc procedure. Mine was kind of like, okay, this is what we've got to do. You've been in the hospital a week. We need to get this chest tube out. It's, whatever. So I had that talc procedure, but what I didn't know, it wasn't like it was a secret, but I guess I just didn't think to ask, is that the talc procedure itself, the talc shows up in a CT or on a PET scan. So now I went from like a chest CT that looked fine even after surgery, like with radiation. You saw scar tissue, but you didn't see cancer. And then after having that lobe removed, that my lungs look great because that was the only one spot. But now I've got these edges that are lighting up white in these tests. And Dr. Singhi kept saying, now remember, this is your first CT and we see all this white. This is the talc. And so now what we have to do is that's my new baseline for watching for, and that kind of is a little bit nerve wracking because you're like, wouldn't it be nice not to have anything showing? So if something lit up, you're like, that's what it's progression or whatever. So that is something to note that if you end up having that talc procedure, which I think it actually is more common than we think, because since then I know 2 more patients that I talked to prior to surgery that reached out to me that have had it done as well. I guess air leaks are more common than I thought. So that is something to take note of there.
Leah, I want to quickly jump in.
Yes, sure.
Since I live in North Carolina, I do have phone calls, I think every 3 months when I have scans. And Dr. Antonoff, she send them through PowerShare with Duke. And so she'll review them and then we'll have like a quick 15-minute phone call saying everything looks good. But if something did pop up concerning, she can't give any medical information over the phone or across state lines, but she will tell me, come, let's schedule an appointment. I need to see you type of thing. So it's nice that I still have this relationship with her. And I did see her in person a few weeks ago, but that's been the first time since surgery that I saw.
It's nice to remind people that, because I switched all my care there, I do have a local oncologist. Haley and I share an oncologist and that I see every 6 weeks here, but he primarily just checks in on me, does blood work, weight, the normal stuff. So we talked about what they kind of do at the post-op appointment. Scars, that's, a big concern. And I just got back from spring break with my daughter in Cancun. And here I've got this semi-fresh, not 6-month-old incisions. What do you do for scar treatment? And did you do anything? Lexi, have you done anything? I know you're the newest out, so you may not be approved to do that kind of thing yet.
Yes, not quite yet, but I do have this like scar gel, which is similar to like the silicone like strips. It's all in the same vein, but I had used it for my surgery the first surgery I had, which was to stabilize my leg. They put a prophylactic nail in my femur to stop it from breaking. And so I used it there and it was helpful. And I've not yet started to treat my scars from this surgery. But I mean, the best thing, if you can, right, is to just cover it up, if possible. Of course, that's not always possible.
Haley, what about you?
I really haven't done any creams or anything. Mine looks fantastic. You can see it. Like a big thing is just to put sunscreen on it. But yeah, mine's pretty clean looking. No complaints.
Yeah. My incision looks good, just as is, but I did go, I see an actual oncology dermatologist here in Louisville, and I made an appointment with her just to see what she would say. And she recommended either the scar gel, the silicone scar gel, or the actual, I brought it for show and tell, this scar sheet tape. And this is what it looks like cut. And so my husband travels quite a bit. Mm-hmm. And she said, you can put this on because I have a hard time reaching my incision. It's so long. So she told me that I could actually just cut these long enough to cover my incision and that you can put it on and leave it on for a few days before you take it off. So shower in it and everything. I will also say this was nice when I went on vacation to Cancun because I put sunscreen on it, the stick. I used the face stick, so it was like chalky and thick. And then I put this over it. Now I have a nice white rectangle on my back, but it didn't get sun. So the scar therapy, I've even cut smaller ones to go over my chest tube place, and they all look good. So, and she said that scar therapy only, she recommends it only from like month 3 to 6 is where she says to use it. So just a little tip there. But yeah, scars are, it's like a badge of honor, right? It's just part of it.
Yeah,
People
that's
have
what I
asked
was
me if I'm
gonna
concerned
say.
about it. I'm
Badge
like,
of
no, not
honor.
really.
Yeah, I don't
Yeah.
really.
Good riddance. Yeah. So, okay. And then let's see, we talked about that. Okay. Here's some good questions. And these are a little bit hard because they're not really like a definitive type thing. But one is, how long do you think recovery really takes? And I know Lexi's probably still in this until you feel back to normal. And I hate that word because what is normal, right? So, Terry, do you have any words of wisdom there on how long it took you to feel normal again?
I've never been normal, so I don't know.
Right.
Baseline back to when I was before, I'd say that I still can feel nerve pain. It doesn't bother me. And I still have reduced lung capacity. Also does not bother me because I'm still doing all of the things that I love to do, hiking and running and working out and getting around just fine. But I would say like around 2.5 months was when I started to notice a significant difference for me in terms of what I could do.
Yeah.
Around 2.5 months. Yeah, 10 months.
Okay.
But I think I started
Mariah, I'm
at
sorry.
8 weeks. Sorry about that. Started working out around 8 weeks.
8 weeks. Yeah, I thought there was a big change at 8 weeks too. Now, Mariah, I know you had a lot of complications. So for you, I mean, it probably took much, much longer. Maybe you're not even there yet.
Yeah, I'm trying to remember. We were out of town for Thanksgiving, and it was bad then. Yeah, I passed appointment with Dr. Antonoff. I mentioned chronic pain because I asked my physical therapist, "Is this just something I'm just going to deal with?" And he said, "Probably." But when I was out of town, I actually didn't experience the same pain that I do at home until I got home again and my child like almost tripped or something and I could feel the scar area just like react. And I asked my physical therapist, feels like I have two different brains because like I just think now like my worrying, anxiety, like that's where like the pain kind of concentrates. So we were talking about nerve blocks with Dr. Ansoff, but I don't think it is a chronic pain thing. So we're kind of doing breathing exercises, also massaging the area, always waking up those nerves. Still to this day, it'll be a year in June, and yeah, I'm still every day I experience something. But it is definitely more tolerable. Not having to rely on the pain medicine is great, and also the daily stretching and physical therapy exercises. I notice a difference when I take a few days off and I haven't done those. Like I have to always be on top of those, but that helps. But I don't remember. I'm still dealing with it. Yeah.
I hate that for you. Haley, but what about you?
I probably was about the 2 month mark too. So mine was in May. We went to Mexico, I believe, in July, and I was fine. I mean, it's still like carrying large things was kind of irritating. It just was like kind of an ache in my back. I didn't have a lot of the nerve pain that y'all had. And then we actually did Germany and Switzerland in September after doing that. And I was very, very worried about these crazy elevation changes and how I was going to deal with that. And it was as long as I took my time, I like still felt like I was really able to enjoy my trip. I mean, even we went to like the highest like Matterhorn viewing point. I was fine up there. I just had to take the stairs a little slower. I gave myself extra time because everything is up and down there. So, like if we were, going to have this uphill walk from our Airbnb, like Justin and I would leave earlier than our friends that we were with just to give me a little extra time. And the only time I cried was when we did the e-bikes in the mountains because that probably wasn't the best because I was like, I can't do this. Can they come pick us up? I don't know where we are. We're on a trail. But I was able to push through and do that then, which was a huge accomplishment for me because I was like, I am going to enjoy this trip and I'm not going to let this devastating diagnosis define me for this trip, which was because I was just so worried about those elevations and being able to tolerate it, but it was fine.
Wow.
Well, good. Yeah, I think it's a journey. And I do think, like many of you said, like the scar tissue, it is what it is. Like that's something we may just have to like manage, visit from time to time for sure. And the breathing, like Terry said, it's a little bit, lung capacity is a little bit less. Mine's the same way. I don't really notice it I guess the biggest times I notice is like carrying laundry baskets up the stairs. I'm like, why
Me
am I so
too.
winded doing this?
No.
You know, or like doing burpees, like where you're like down,
Ugh.
up, down, up. The positional breathing is what kind of gets me. But day to day, I mean, you know, walking and talking and all that kind of stuff is pretty okay. This is one that Haley and I have talked about before, so I'm interested to see what you all say. What about your immune system after surgery? Do you feel like anything has changed in terms of right after surgery? I know Lexi's still in that little right after. The rest of us are a little further out, or I guess you guys are further out than I am. Believe that, you know. But what about that immune system? Do you feel like it's weak? Do you feel like it's fine? Haley, you tell me your opinion because we've talked about this before.
So I felt like, and not even directly after surgery, it was more a couple months later. I guess, because my surgery was in May. I felt like I had a horrible cold like every 2 weeks. It was like if someone barely sniffled around me, I was getting it. I mean, I would lose my voice. It was just horrible. So I kind of asked my oncologist at MDA, I'm like, what can I do? Is this normal? I don't think I was expecting that after surgery. And he's like, well, yeah. He goes, something that probably that you could have fought off whenever you had, both full lungs, it's a little bit harder for you to fight off now. He was like, you can try immune boosting vitamins. He was like, some people say it's hocus pocus, some people say it's not. So I actually, knock on wood, have not been sick since probably the very end of this year. I did start taking the same thing as Leah. It's like the Zicam zinc with vitamin A and C. And I don't know if it's hocus pocus or not, but I'm going with it and I'm going to continue taking it because I do feel like it's really helped with having little kids who lick and touch everything, especially a little boy. But I have not, like our big trip, I didn't wear a mask on the plane. I was fine somehow, even though that was kind of around the time that I was catching these colds. I don't mask whenever I'm traveling usually or anything. So I just make sure I wash my hands. I do not touch my face. And then I'm taking those vitamins.
Part of it's maybe the weather, the time of year, whatever. But I got pneumonia 4 weeks post-op,
Ooh.
which was not ideal with and all the things. And then again, I had some colds too. So we did a deep dive, Haley and I did, and taking the Zicam with the zinc and A and C. And I mean, it is getting better. Terry, did you notice your immune system at all?
I didn't notice anything. I did get COVID not long after, and that seemed to go as fine as it can go. I
Yeah.
did have a consistent cough directly after my surgery that took a while to resolve, and that was not immunity related. That was just surgically related.
Surgery.
But otherwise, no, I felt pretty good.
Yeah. Good.
I did want to add, whenever I asked my oncologist too about the hoarseness, because I had never really experienced that, or definitely not every single time I got sick. He was like, that's probably has to do with some sort of nerve that it's inflamed or was severed whenever you had your surgery, and that's why you're more likely to have this hoarseness or losing your voice completely with getting these illnesses. I didn't expect that either.
And I know Terry mentioned this cough after surgery. I don't know about you, Lexi, because you're the newest out. But for me, I did that before the pneumonia. I was coughing, and it didn't happen until I got home from the hospital. I didn't cough at all in the hospital. I got home, I started coughing. So that's kind of leads me to my next question. Is there anything about this surgery that is triggering from past lung cancer related experiences that kind of caused you anxiety or stress because of what had happened before? In your diagnosis. Lexi, do you have anything like that? Did you think anything was triggering about it?
It didn't in that way. I mean, I didn't start out by having coughing symptoms prior to being diagnosed. It was all very physical pain because the tumor was in my leg. Or at least that's the one that I felt. That's where I had the pain. So it wasn't in that way for me that I would imagine it could be for others. But I, did have the coughing, which was really bothersome. It has gotten a lot better. I think for me, the only thing that was really triggering was not being able to take treatment for so long. I think that was the thing for me that made it really difficult.
Terry, what about you?
For me, because I did have that persistent cough at diagnosis. And so that felt concerning to me. I was really kind of watchful over that cough. And also just the feeling that I'm officially a patient again in everybody's eyes, in my eyes, and just having people taking care of me. I'm usually the one taking care of everybody. and everything, and just being in that position of being looked at as, oh, you have cancer, you have terminal cancer, you have stage 4 cancer. Having that feeling of vulnerability again was a little bit triggering for me. Yeah.
Mariah, what about you?
I agree with Terry about feeling like a patient again. I was at Disney World the April before and doing all the walking and whatnot and exercising in between those chemo treatments. And then to just get back to like ground zero, just basic stuff and feeling so helpless. It was mentally challenging. But also the coughing, I was coughing up blood. And that reminded me of before diagnosis. And um when I was back a few weeks ago, it reminds me of like giving birth and you just kind of block it out. But then when you're back and you're visiting and the last time you had surgery there, it's just like, oh my goodness, I can't believe even preparing for this panel, just reliving all the conversations and just the thinking back on that pain, and it is inspiring how far I've come from feeling like, a zombie to, being active and doing the heavy strength training that I didn't think I'd be able to get to finally. But one thing I wanted to mention about the chest tube when we had a previous conversation, when I was diagnosed, they gave me ketamine, and that for me was the most traumatizing thing out of the whole cancer diagnosis because I was hallucinating like crazy. I'd never experienced anything like that, and it felt like drowning and dying. Just, yeah, these ceiling tiles were just, I couldn't breathe. And so that whole thing for me was awful with the chest tube. So thankfully, being knocked out for surgery was a much different but bearable thing to deal with.
Yeah. Yeah. Haley, what about you?
I agree with the like being a patient. If I was doing anything, I mean, my daughter was like, "Can you please come and eat lunch with me at school?" It's like I had to go with my little chest tube purse, up there. That was kind of triggering. And then also kind of how Leah talked about earlier is that now like the scans, I'm like, okay, is that something, or is it really what Dr. Antonoff is saying? And that's just a post-surgical change that I'm going to have to look at as just that. And it's not, because I would rather everything just be black and white. Like your lungs look perfect. There's nothing anywhere. So that's kind of taken some getting used to, because even on PET scan that I've had, like you do still see some changes from the procedure or the pleurodesis.
I agree. It's interesting. So, like, I was diagnosed in December, and then when I started feeling bad after surgery was in December, and that I think was the worst part for me because I remember it was Christmas time. When I was diagnosed, I couldn't wrap gifts. I was miserable. I was coughing. Well, here we are. It was December 5 years later, which they told me no, there wasn't much chance I was going to make it there. And it's the same things. I couldn't wrap gifts. I was coughing. I was in pain. And it was more of like, I really thought I would want to celebrate that 5-year cancer anniversary mark. And I haven't even posted about it until recently. And I haven't written about it because I just couldn't go there, which was, and I think it was just because all of it, being in the hospital, being a patient, waiting on the pathology, all of it was just happening around the same time. And it was just a little too much mentally to take in. I know this is turning into a longer episode, although I think people are going to like it. They might have to just watch it in pieces to break it up. But before we leave, I'm thinking, what would be your best one piece of advice for recovery if somebody else was going to have surgery? And I'll start first. I think the biggest advice that I would give is not to think, because I've done so well on treatment and I've been through so much and I'm just going along and it's great, that this recovery is truly going to be what it said. They say it's 6 to 8 weeks for a reason. Is really make the plans you need to plan, do the things you need to do, and really take that time to relax and take care of yourself and eat right and heal, because I think in the long run, that's what's going to make this a faster recovery than if I were trying to do all the things all the time as soon as I got home. So that would be mine. And let's see, Lexi, do you have what your biggest piece of advice would be?
For recovery specifically, definitely walk. Things that we've said around just making sure that you stay active, nurture your body in the right way, sort of like force yourself if you need to, find creative ways to get that protein, whether it's with like a smoothie or whatever it is. That, and keep up with your breathing.
Great advice. Mariah, how about you?
Jumping on to what you said, giving yourself grace 6 to 8 weeks, also thinking that it could be even longer or it could be shorter as well. But yeah, I'm glad to know that my experience is not the norm for this procedure, but just have a backup plan if, things do become complicated and you need the extra help and whatnot. And physical therapy for sure couldn't be where I am right now without it.
Haley, what about you?
Probably lean on your community as much as you can. We don't live local to any family, so that's kind of always a harder thing for me is just we did have, immediately after, like my mom went to MDA with me and my husband. So my mom was there then and my in-laws were here. But kind of after everybody had gone home, it's like, what do you do? And we are so blessed here that we have in such a short period of time, because we've only lived here for about 4 years, so many great friends that have become family and neighbors. And I mean, they're there for you. You're not being bothersome by asking someone for help if you really need it, because the fatigue is so rough right after. And rest, like take the naps. You're not a failure if you have to take a nap. So
Take it easy. We're not very good at that. Terry, what's your advice?
Be honest with your doctors about your pain. And don't try to be a superstar patient all the time and kind of gloss over what's really going on with you. If you want PT, ask for it, even if they haven't offered. If you want, scar therapy, even if you don't know what that is, ask for it. Seek it out. Be a good advocate for yourself and prioritize yourself, as hard as that might be when you have young kids. Make sure that you're focusing on yourself and your recovery at this time. And also find some really good shows to binge, because you're definitely going to have downtime. So if you can find something good to take your mind off, your situation, and maybe share that with your kids or your husband, that's a good way to connect to.
Well, I think that this series will be so invaluable. I wish that I had had this at my fingertips prior to surgery, or even the thought of having surgery. Just from the very beginning, this would be such a gift. Once again, I really, really, really thank you guys for being here. I know this took out a big chunk of your day to film all 3 episodes. If you are watching at home, please like and follow so that you can maybe see some other things that we're doing. And also, if you miss episodes 1 and 2, you can easily find those to watch in preparation for surgery, or, if you're just kind of thinking about whether this is for you. Of course, none of us are physicians or medical experts. So, anything that we've suggested, this is just what's worked for us. So, if you have any real questions, please ask your medical team, and they'll know what's best for you and your exact case. But thank you to Mariah, Lexi, Haley, Ashley, and Terry for being with me today and sharing our different perspectives on surgery.
Hi.